When I started teaching, I had a lot of big ideas. I was going to mold young minds. My desk would be covered in apples from grateful students. And my heart would be filled with that purpose that you can only get from doing something truly meaningful. Needless to say, I didn't get any apples. But I did, however, get a stool. Now, I was 22 and starting my first job as a teacher at Sharpstown High School, one of the 4 lowest performing high schools in Houston, Texas. And if you can believe it, I look younger than I do now. This one day, I ripped into my student Reggie, saying, "Reggie, you got to do your homework." "Nah, Mr. Wei, you're tripping," he says. Reggie was 6'3", 240 pounds, defensive lineman, full beard. I stood in his way. 5'9", 150 pounds, peach fuzz. Reggie proceeded, in his frustration, to grab my teacher's stool and fling it at me at 40 miles an hour. Now, here's the deal. In nearly every school and every classroom, there's a Reggie. And we're not doing a very good job of helping most of them. Why? Because in the classroom, we can only see the symptoms and not the underlying problems. And so that's all we can address. We can penalize the child for throwing the stool, but can we ask the child what is causing him to make that choice in the first place? And I knew that if I asked for most of my kids, the cause started outside of the classroom. Some were dealing with abuse, others with trauma, hunger, homelessness, many a combination of all of these. Homework? You're tripping. I loved all my students, no matter what they brought with them into the classroom. Even Reggie, especially Reggie. My desire to help ultimately led me outside of the classroom and into an unexpected place, the tech sector. My name is Albert Wei, and I'm the Chief Innovation Officer at ProUnitas. And we are using technology to coordinate and disrupt the way social, health, and educational services are accessed and delivered. In the US, there are over 1.5 million nonprofits, all tackling issues from hunger and homelessness to childhood obesity. Every single day, these organizations are doing absolutely vital work, but almost none of them are doing it together. Because how could they? There's no formal system to collaborate. That means no way to identify students that need them the most, no way to lean on each other, and no way to track impact. When we work in silos, children inevitably fall between the cracks. In other words, we are a country that is program rich and system poor. This is where technology enters the picture. Our platform, Purple, is restructuring the way organizations collaborate around individual kids. Because after all, it takes a village. Purple does 4 things. First, it flags the students who need the services the most. It then connects the students to the unique set of services that they need. It monitors the students' progress, all on an easy-to-read dashboard. And lastly, it knowledge manages this data so students' records are kept up to date, allowing for a warm handoff from caring adult to caring adult. We've launched Purple in Houston, with over 70,000 students on the platform, supported by over 10,000 documented touchpoints, and we're getting results. Districts now know what services they have, who is in them, and what impact it's making on kids. 90% of teachers interfacing with our platform reported feeling more supported. Social workers and counselors have reduced their paperwork by about 60%, which means more time for more kids. And for the first time, we're not asking people to do more. We are making more of what they are already doing. Currently, we are in about 90 schools in Greater Houston, and we plan to expand to 600 within 5 years. We're expanding beyond education and into healthcare and more, because as we know, it's all related. And the better we can create systems that connect us, the better we can work together to serve the people that need us all the most. I wish I had purple when I was in the classroom with Reggie and so many of my other students. But luckily, Reggie was able to dig in and work his way to Texas A&M University, where he graduated just last year. But he didn't do it alone. It took a collection of unusually devoted mentors, counselors, teachers, that all wove a social safety net underneath him. Luckily for Reggie, at least one person noticed his potential. But what about the millions of other Reggies that often get overlooked? What are we doing to better support them? We need to take the luck out of who succeeds and who doesn't. We need to take the pain out of going the extra mile for kids, and we need to do it together. We need purple. Thank you.